Hi everyone, I'm Janine Lassant, your host for the day here on SSP TV. We are back here, Skin Sense, DermDox, and the doctor, and also we have the Zach.
Hi guys.
How you doing?
I'm good. How are you?
Good, good.
Well, you don't need me here then.
Yeah, I mean you can leave.
All right, three's a crowd.
We normally don't need you here.
Yeah, she said beforehand, three's a crowd, and I refuse to leave.
He's like, I'm going to be on the show.
I'm going to be.
We have a case study to talk about today, but before we get to it, tell us what's been going on. I know you guys have grown, and you have a new office in Harrisburg.
We definitely do, in Camp Hill, and maybe Zach can tell us a little bit about what's going on
Zach's
there.
seen it and
Right.
works there.
So we have a very nice brand new office in Camp Hill. That's out near Harrisburg, Pennsylvania. It's a state-of-the-art facility. It has the capabilities of keeping patients overnight if required for certain studies. So, you know, we can do a lot more there than we were able to do here. There's a lot more space, a lot more equipment, and that means, you know, a lot more study indications that we can do research trials for.
It's a huge office. It's dedicated just to clinical trials. Okay, and everybody knows by now that we're kind of known for that. Okay, we're one of the largest independent dermatology groups that does clinical trials for major pharmaceutical companies, okay, like the Amgens of the world, the Galdermas of the world, and we do them for smaller companies as well.
Tell people why those are important.
Well, they're important because before a drug is released on the market, you have to do these studies to make sure, number one, that it's safe, and number two, that it really works. So those are requirements by the FDA, okay, that they're the ones who basically monitor all drugs in this country. And they insist on studies, and they tell you basically how the study has to go. So it's very, very important to do.
And we're always looking for people to participate in these studies. It's a benefit for you, and it's a benefit for new medicine. So it's a win-win.
Right, it's definitely a win-win because people not only get the medicine for free, but they get paid to use it. Okay, so that's a really good thing. And a lot of the medicines that we've worked on in the past are, you know, now drugs that people get. So, and it's great for people who don't have insurance, who don't have prescription coverage, because some of these drugs are really, really expensive. I mean, one of our staff members just told me she requires a drug for like 6 or 8 months, and her out-of-pocket cost is $900 a month.
That's more than some people's mortgages.
Yeah. Yeah, so in this country, something has to be done.
Yes.
You know, so, but I was shocked when I heard that.
So Zach, what study are we focusing on today? There's two?
So there's a few studies that we can focus on today. One of the main ones that we want to focus on is our study for atopic dermatitis. That means eczema, dry, itchy, rashy skin. And we're looking at that in the adolescent population, so between the ages of 12 and 18 specifically.
Now, when you say eczema, what does it have to look like, or how far along does the eczema? It has to be active, right?
Active, moderate to severe is what we're looking for, so over a pretty substantial body surface area. Okay, like flexor creases are usually where people develop it, usually either fall or springtime is when it comes out. Also, flexor crease of the knee, back behind the knee. That's another spot that's common.
It's a very itchy skin condition, and people who have it are by and large miserable. A lot of times it happens, you know, when you're really small, you know, age 2 or 3, it comes out. Sometimes it starts getting better as an adult, but, you know, a significant percentage of people just have eczema all their lives.
Well, sure, and when you're younger, I know when my son was younger, he has eczema, but he was younger, so if he would get out of the pool, he would kind of dry off and not get behind the knees, so then he would get the flare-up from behind the knees. So taking care of the skin so that you don't have an outbreak.
Right. Well,
It's
I mean, you
easier
can
as you
just
get
do,
older.
yeah, you can just do so much. You try to moisturize, you try not to use harsh soaps, try not to overly bathe. But, you know, when you have bad eczema, you really need medication.
Okay.
Okay.
So if a mom or a parent or a guardian is watching, or even someone who is, you know, under 18 is watching the show, what are the qualifications? Like what do they do they have mild to moderate eczema, and what do they need to do to participate in the study?
They would need to come see us so that we can do a full check of their previous medical history, see what medications they're currently taking, make sure that nothing interferes with the study. Anything that would be potentially dangerous to be taking at the same time, we rule that out. So just basically making sure that all the right parameters, their blood work, all the testing that we do on the patients, EKGs, everything is healthy to start a study.
And this is all paid for by
By-
DermDox,
By
right?
the drug company.
By the drug
Yes.
company. So
Yes,
it's no
yeah.
out-of-pocket money to you. So if anything, they get a nice physical out of it, right?
Absolutely.
Yeah,
So
they
once
do.
they are approved, if they're approved, then what happens? How often do they come in? What is the requirements?
So usually in the beginning of the study, it's a little bit more frequent. We see you about every 2 weeks, and then towards the middle of the study, we see you monthly, and then at the end, it's still about a monthly visit, but usually the studies don't go out longer than 32 weeks.
Okay. And is this something that you do only at this location, or would they go to either locations?
Well, we do studies at here and we do studies there.
Okay.
And this location we're going to be doing here.
Okay.
So, and again, a lot of people don't even know what they call their rash. They may be itching for like years and whatever, and some people just don't even go to doctors. They just live with the itch. But I'd urge any of you, if you have anything that's like eczema is a real itchy condition. As Zach said, you usually get it, behind your elbows, the back of your neck, the back of your knees. And that's classic for eczema. And there's no reason to really suffer with it anymore. You all see the TV commercials for Dupixent, for Rinvoq. And these are really, blockbuster medications that revolutionize the treatment. So, and we're just testing out another medication similar to those to see if it helps, as well as those, or perhaps even better.
So this must be exciting for you, because how many studies have you seen go through and then medications develop that you guys have been a part of? And you could be a part of,
Yeah.
right?
Yeah,
Absolutely.
right. And Zach, you've joined us what?
I feel like you've been here forever.
3-4 years.
Yeah, 4 years ago, and in that time, he's seen so many new drugs that we've tested, and it's just really a cool thing to do, because the goal is to get people on medications that work.
Yeah.
And not every medication that's out there now is effective for every person. So we need new drugs, and
Yes.
of course, we're working on it.
All right, when we come back, what's the next topic?
Next topic is a condition called hidradenitis suppurativa.
Oh, right, I'm glad I made him say
Yeah,
that.
you won't be able to pronounce it.
Say supercalifragilistic.
Yeah, exactly. Yeah,
expialidocious.
yes.
So when we come back, we'll talk about another study here on skin sense seen on SSP TV. And welcome back. You're watching Skin Sense here on SSP TV. Thank you for watching us on local cable in the greater Hazleton market, and also on YouTube at SSP TV. And you can check us out online at ssptv.com, where you can see all of our programming, including Skin Sense. Today we're talking about clinical studies that are helping develop new drugs. The first one was for eczema in youth, right? So 18 and under.
12 to 18.
12 to 18.
Yep.
So if you're a candidate, you can call the office. The number's on the screen. And the second clinical study is
Hidradenitis suppurativa.
supercalifragilistic expialidocious is what I'm calling it.
It'll
So
be
what
a
is
while.
It's a mouthful.
Yeah, it's a mouthful.
It is a mouthful.
Yeah, but it doesn't affect your mouth though. Maybe yours.
this? Maybe mine.
But anyway, so Zach, you want to talk a little
What
bit
is it,
about
Zach?
the condition?
So hidradenitis suppurativa is a condition where your body produces too many inflammatory molecules that accumulate in certain areas, usually where there's more hair follicles. So it seems to be located under the arms, your axilla, the groin area, could even be, in the genitalia region. So it's in a very uncomfortable area because all of these areas rub when you walk, there's friction, and if you're getting boils and, blisters and things that are painful there, then it's already going to be amplified by that constant friction.
And what you can see in the pictures, in the photos, they're really cysts and abscesses, and they arise in, as Zach said, under your arm, in your groin, your thighs, and they are very, very painful, and they can leave scars. Okay, and there's no great treatment for this condition except antibiotics, which we put people on. They have to stay on for years usually.
Wow.
There's a medication called Humira, which is a biologic, which is injectable. It's used for psoriasis too, but we use that as well. But unfortunately, some patients respond, some don't. Many times what we do is we actually inject the dissolving medicine into the cysts whenever a patient gets them. But it's a horrible disease. And again, a lot of people don't know they even have it or what the name is. They just, call it like I have an infection. Okay, but in those areas, yeah, we call it hidradenitis.
Does this affect certain people, or who's the clinical
That's a great question.
So we see it more in females.
Wow,
So
okay.
females tend to have this condition. Females will also see it under the breasts. That's another common area. Smokers, usually if you're a smoker.
So
that has some
anyone
association.
who has this could come in, but specifically female, are you looking for?
Well, no. It can happen, yeah, I mean, it can happen in males too. And certainly people who are overweight is a much greater tendency. And as Zach said, smokers have a greater tendency to have this affliction.
Okay.
So, but yeah, you kind of know you have it. You may not know what it's called, but the fact because these cysts are painful, and they're over time they get scarred. Okay, so patients have hideous scars in their groin and the lower abdomen. So you want to catch it early.
Okay.
And we're just hoping we'll have a more effective medicine for this condition, which is what we're going to be testing.
All right. So what are the qualifications? You just have to have it, or think you have it. You come in, you get the blood work, you get the EKG, all the fun stuff, right?
Yep, if you think you have it, or it sounds like you have it, come on in, see us, we'll screen you. We'll do a physical exam, make sure that what we're seeing is actually hidradenitis suppurativa. We'll get the blood work, like you said, EKGs, all the safety workups, and then if everything looks good, then we're ready to start.
32 weeks.
This one would be about the same, yes, 32 weeks, okay?
So they commit to coming in, and what's the compensation for the patients that partake in the study?
Good question.
varies.
Every study is different. So, but it's usually pretty good compensation.
Okay.
And they usually get paid every time they show up at the office. So sometimes they have to show up every 2 weeks for little tiny injections. Sometimes it's not for 6 or 8 weeks at the end of the study. But again, it's a condition that affects like the oil glands. That's the easiest way to describe it. And the way people have acne, and we've seen people with really bad acne, well, you can almost say it's like they have acne of their armpits, okay, or the lower abdomen, of their thighs, their groin, and even their backside. Okay, so you can imagine how painful this is.
So are these something like you don't want to touch or pop or do anything with?
Most of the time you really can't because they're so deep.
Okay.
And what happens is they actually leave what's called sinus tracts, which are openings to the outside. Okay, and then they can drain on their own. And it's a real sad disease.
And you would think there would be more for something so severe like this.
Yes, absolutely. You would think we would have better treatment.
What would they actually be taking? Some patients would be actually taking the actual drug.
Right.
Others would be taking a placebo, right?
That's very important to discuss because some patients come in thinking that, yes, they're going to get medication, but not everybody gets true medication. Some people will get the placebo. That's the placebo, the sugar pill, the fake medication, basically, just so that the study can be standardized and compared in those separate groups to see what's effective.
Is it always like an oral drug, or are there topicals?
Could be topical, could be oral, could be injectable. Okay, in some of the studies it's good because you might get the placebo for, say, the first 6 weeks, and then you would switch to the active medicine. So it's just sticking it out for those 6 weeks. Some studies are like that, which is great for the patients because we know sooner or later they're going to get the active drug.
And I know we've done other clinical studies, from these clinical studies, like where is it in the steps? Are they all in different steps of where it goes from there? It's not like you do the study and then it's like, oh, they're on the market.
That's a great question. And clinical studies go from what they call 1 to 4.
Okay.
Okay, and a 1 is a brand new drug that you only have a few patients on because you want to make sure it's safe. You want to know what dosage
Okay.
is safe, and you want to know if it works for the condition.
And then they keep like.
And then you keep up. By the time you get to 3, then you're talking, there may be 300, there may be 1,200, 1,500 patients in that study. So, and then once the drug is out there, then sometimes drug companies will do studies just to see how well it's working it's approved. But we want to see how well it's working, and maybe it's working for other conditions as well, which we can pick up by doing additional studies.
So we have 2 studies, clinical studies, that you can be a part of. It's the eczema for 12 to 18 years old boys or girls. And then we have
Hydroadenized. That's the easiest way. Forget the second.
hydroadenized. All right,
Yeah.
so the number's on the screen. If you have any questions, you can certainly call and speak to the office if you feel comfortable doing that first before you make an appointment, and then you could be a part of these studies, maybe get some relief with your own skin condition, and also get paid for it.
Perfect.
Absolutely.
You said it all.
And I wanted to highlight it's not just for that age group, 12 to 18, it's for adults as well, but we just started enrolling the adolescents.
All right, so
Right.
if you have
Everyone.
eczema, stay with us. It's for everybody. And thanks for watching us. If you missed some of the show, you can watch it on ssptv.com, and you can also watch us on YouTube or here on cable. We'll see you next time.